going to do a piece by Gospel News. I will do it in 20-minute videos because it's quite a long piece, and I will leave a link below in respect of this story. This story was written on the 26th of March 2021 by Fabio Giuseppe Carlo Carioso, and the headline is EU hard lockdowns are crimes against humanity. Italian magistrates complaint to the Hague court. Lockdowns are all related measures, the latter if adopted for prolonged and indefinite periods of time, well beyond the health emergency phase, so as to risk distorting the very essence of societies, and this is the case, are a crime against humanity, as they constitute the crimes of imprisonment, torture, and are acts causing great suffering to mental and physical health, Section 7 of the Rome Statute. This is one of the most disruptive sentences of the explosive complaint signed by the Italian magistrate Angelo Giorgiani and sent yesterday, Wednesday the 24th of March, to the prosecutor of the International Criminal Court, ICC, Ms. Fatou Bensouda. We strongly urge you to consider declaring lockdowns and all related measures, mask mandates, social distancing, ongoing closure of schools, businesses, bars, restaurants, gyms, museums, theatres and more, a crime against humanity. The economic, human, psychological and social costs of these policies are considerably higher than their effectiveness in saving lives and reducing the spread of the virus, wrote in the complaint to the Hague Court Dr. Giorgiani, and a Sicilian civil judge, as Secretary General of the World Life Organization, OMV in Italian and WLO in English. OMV or WLO is the new international organisation of cultural voluntary service born in the wake of the Italian Association, the heretic, founded by the magistrate together with the Neapolitan coroner Pascal Bacco to counterbalance the excessive power of the WHO, that's the World Health Organization, now firmly controlled by the tycoon Gates, who is the main financier in a clear conflict of interest for his clear financial speculation in Big Pharma, is evidenced by 33 Wuhan Gates investigation. Thanks to a growing collaboration between the media Gospel News, a Christian journalistic information portal, and the WLO News, the information platform of the World Life Organization itself, we are the first to be able to reveal the contents of the complaint already anticipated by Giorgiani himself in some videos such as Nuremberg 2, as based on the violation of the Nuremberg Code, which in the historic trial held in autumn 1946 in the German city cost the death sentence to Nazi officials accused of crimes against humanity, 24 death sentences, 20 life sentences, 98 sentences and 18 months to 25 years in prison. The complaint to the International Criminal Court is a white paper of the tragedies caused by the pandemic from COVID-19 in a precise statistical collection based on authoritative and international sources of the social horrors deriving from the imposition of national governments. The report analyses with particular attention those of the Italian government of the former Prime Minister Giuseppe Conte, because the studies mostly refer to statistics relating to the period of management, although the Prime Minister Mario Draghi has continued on the same dangerous slope in compliance with the desired continuity. But the complaint also highlights the tragic situation in the US, UK and Germany. interpretation and renunciation of health care for serious illnesses, devastation of the family relationship network for sick, elderly and disadvantaged children, mental disorder and alcohol and drug abuse, loss of jobs, increase in suicide, juvenile hardship and pernicious puberty and causes of self-harm, infant malnutrition, higher morbidity and mortality risks associated with states of apathy and depression. They are just some of the consequences of lockdowns. Quarantine and masks listed in 37 pages of exhibit, complete with the name and surname of the scientists and health facilities that detected them. Amongst these, there are also the opinions of technical components of the World Health Organization itself, who have been ignored, just as happened to the Venetan Francesco Zambo, invited by the leaders of the same health organisation not to reveal contents of his dossier on the failure to update the pandemic plan of Italian emergency on the Bergamo Public Prosecutor's Office is now investigated for crimes of forgery and culpable epidemic. According to the Canadian medical expert Dr. Ari Joseph, the harms caused by lockdown measures are at least 5 to 10 times greater than the benefits, as a population plagued by economic downturn, unemployment and loneliness is at a risk of early mortality and reduced lifespan and chronic disease, over time suicide, depression, alcohol use disorder, childhood trauma due to domestic violence, changes in marital status and social isolation are projected to cause millions of years of life lost, reads the first line of the complaint signed by the magistrate Giuliani. Governments ignore WHO experts. To understand the atomic significance of the complaint, it is sufficient to say that compared to 17 pages of the complaint, there are 20 of scientific literature and citation of published texts. Among these is the book Massacre of State, written by Giuliani and Dr. Bacco, who, together with Alessandro Meluzzi, Giulio Taro and many other doctors in part of the World Life Organization (WHO) Scientific Committee, Dr. David Nabarro, who WHO Special Envoy for COVID-19, said this of the lockdowns back in October. We in the World Health Organization do not advocate lockdowns as the primary means of control of the virus. Just look at what's happened to the tourist industry. Look what's happening to small holding farmers. It seems we may have a doubling of world poverty by next year. We may well have a doubling of child malnutrition. This is terrible, ghastly global catastrophe. It is one of the sentences extrapolated from the complaint on which the prosecutor of the International Criminal Court of The Hague was called to investigate. Just as such opinions are being ignored, governments are even bickering over vaccine stocks as part of the World Health Organization's immunization project. Although colossal business is hiding from this, as the pharmaceutical multinationals that control Pfizer and is owned by the founder of Microsoft. The collateral damage now being caused to the population will have greater impact in the short and long term on all sections of the population than the number of people now being safeguarded from corona. Social isolation and economic damage lead to an increase in depression, anxiety, suicide, interfamily violence and child abuse. Studies have shown that the more social and emotional commitments people have, the more resistant they are to the viruses. It is much more likely that isolation and quarantine have fatal consequences. We read in the complaint that the reports this and other passages from the book Massacre of State by Giuliani and tobacco, the infection fatality rate seems to be about the same as the influenza, but we have never introduced these drastic measures before, and we have influenza pandemics and we cannot live with them for years to come. The World Bank has just estimated that the corona pandemic has caused an increase of about 100 million people living in extreme poverty. This is not because of COVID-19, it is because of the draconian measures we have introduced. We need to better strategy, reported also the legal action. The brutal price of the drastic policy is all too obvious amid battered public finances, rising unemployment and widespread business failures. Entire sectors of the economy have been devastated. Throughout this long emergency, the supposed antidote has often been more harmful than the disease itself. The reality is that COVID represents little danger to the vast majority of people under the age of 60, yet our whole society has been upended by the exaggerated response, and the scars will last for many years. We think government lockdowns cause us substantial collateral health damage. Hospital administration in the US for emergency treatment of acute ischemic strokes have been substantially lowered in February-March 2020 than in February-March 2019, resulting in delayed treatment. The situation is similar for patients with cancer in German hospitals. Cancer cases decreased during the first national lockdown between March the 12th and April 19, 2020 by 13.9% for breast cancer, 16.5% for bladder cancer and 18.4% for gastric cancer, 19.8% for lung cancer, 22.3% for colon cancer and 23.1% for prostate cancer, suggesting that cancers might have been undetected and untreated during this period. Government restrictions are disrupting traditional means of support between friends and family members, physical distancing and contact reduction for causing severe stress to many people and might increase the risk of suicide. Giugiani and Bacchus still report in a crucial passage in the book, reported in the complaint to the Hague, in which the horizon extends to the world situation: COVID emergency, obstacles, cancer patients, fear resulting in social isolation and unwillingness to seek healthcare will increase morbidity and mortality. 2020 saw in the UK a 76% reduction in patients presenting to primary care with suspected cancer, and 5,000 fewer patients presented to hospital with acute coronary syndrome. Health effects related to lockdown and lockdown-induced recession are likely to outweigh the effects of death from COVID, especially the impact on ambitious cancer targets of detecting 75% stage 1-2 cancers by 2028. The media has trivialised other causes of death by not reporting them. Leading causes of death remain dementia, cardiovascular and circulatory diseases and cancer. Deaths seem to have been misattributed to COVID-19. There is no doubt that the sense of proportion has been completely lost, and the consequences are and will be tragic. In addition to COVID patients, there are still millions of people struggling with important treatments and therapies: heart attacks, cancer patients and diabetic patients with stroke outcome and disabling diseases. In Italy, 21 people die every hour due to cancer and 26 people from cardiovascular problems, and these data are destined to drastically and sadly increase in the coming years, again at the magistrate and the coroner. People continue to die of many pathologies, but in Italian hospital, those not infected with COVID feel they are neglected. Since the start of the dramatic health emergency, 11 million citizens are at risk of losing their lives due to the difficulties in accessing care. The pandemic has overwhelmed the National Health Service, and today, to risk the most, it is precisely the fragile patients, that is the oncological and cardiological patients, For these pathologies, in terms of mortality, we have gone back 20 years, eliminating with the swipe of a sponge the extraordinary progress of decades of research. Since the onset of the pandemic in Italy, the fear of contagion has sent about 20% of cancer patients away from hospitals, patients who should have been subjected to useful treatments. Fears are also widespread in those with heart disease. Though there has been a reduction of more than 50% in hospitalisation for heart attacks and hospitalisation for heart failure, heart rhythm abnormalities and pacemakers and defibrillator and dysfunctions are down by about a third. Lockdowns do not stop viruses and variants. The current government measures regarding COVID are not supported by evidence-based medical research, and many of these measures are harmful to individuals, families and societies in general. We call on all levels of government to immediately stop promoting lockdown and physical distancing, the use of masks, quarantine and asymptomatic people and isolation, using RT-PCR testing on people, advocating inadequately tested gene-modifying COVID-19 vaccinations, business closure or restrictions, closure of public facilities, including parks, schools, recreational facilities, misrepresentation of COVID situation in the media. The complaint to the Hague still points out many international studies bear out that lockdowns have proven to be a complete failure as the public health measures to contain a respiratory virus. They did not succeed in the primary objective of containing spread, yet have caused great harm. Lockdowns were explicitly not recommended even for severe respiratory viral outbreaks in all pandemic planning prior to 2020, including those endorsed by the World Health Organization and the Department of Health. The reason for ignoring existing policies and adopting unprecedented measures appear to have been panic whipped up by the media, a reluctance to do things differently to neighbouring countries, and the unfaltering belief in one single mathematical model, which laterally turned out to be wildly inaccurate. In particular, frontline clinicians and experts are alerting policymakers to an impending mental health catastrophe in children and young people. Government action in response to the pandemic have created a perfect storm for the emergence of exacerbation of mental health problems, in addition to creating significant barriers to effective treatment. COVID-19 states vaccines or herd immunity. The complaint then cites other experts at the bottom of the notes who have recently warned that prolonged blockades could encourage the emergence of more dangerous variants. There is already some evidence emerging to support this theory. The Kent variant is reported to be more transmissible and more deadly, while the South African variant is more likely to make people severely ill. It is a coincidence that the prevalence of these variants emerged in countries with very strict measures in place throughout the pandemic. It is a coincidence that the Kent variant dominated following a period of regional and national UK lockdown. If lockdowns are the key to stopping these dangerous mutations, then where is the Swedish variant? Due to human intervention, the course of this pandemic has been thoroughly disturbed. As of the very beginning, widespread and stringent infection prevention measures combined with mass vaccination campaigns using inadequate vaccines will undoubtedly lead to a situation where the pandemic is getting increasingly out of control. Professor Anthony Brooks at the Department of Genetics of Genome Biology, University of Leicester, cautioned that lockdowns, mass testing and track and trace systems together act to hinder mild or asymptomatic spread, whilst giving an unnatural relative advantage to strains that are more virulent, sick, at risk for treatment, children for malnutrition. The World Life Organization complaint then mentioned the reason that led a German judge to declare COVID-19 restrictions order unconstitutional. He noted these consequences of the lockdown: increase in domestic violence against children and women, increase in depression as a result of social isolation, anxiety, psychosis, anxiety disorder as a result of COVID-19, anxiety and other mental disorders, nervous overload due to family, personal, occupational and problems as a result of the lockdown, increase in suicides as a result of unemployment or bankruptcy, health impairment as a result of lack of exercise, failure to undergo surgery and inpatient treatments because of hospital beds being reserved for COVID-19 patients, failure to undergo surgery, inpatient treatments, doctor's visits because patients fear infection from COVID-19. According to Stefan Swarveling Peterson and Anna Mia Ekstrom, two of Sweden's leading experts of global health, restrictions against the coronavirus have killed as many people as the virus itself. They have gone through data from UNICEF and UNAID and found that the vast majority of people who have died of lockdown have died in poor countries and been young. The specific causes of death are malnutrition caused by shutting down the global economy, lack of vaccinations caused by shutting down childhood vaccination programs, and treatable diseases like tuberculosis and HIV that have been prioritised down as a result of the efforts to fight COVID-19. I will leave it there, but I will pick up this story up on the next video.